Well, doctor, for those of us unfamiliar, what exactly does a vascular surgeon do?
We basically work on all of the blood vessels outside of the heart and brain. So anything in the arms, some stuff in the chest, anything in the abdomen, any blood vessels going to organs, and especially the legs. So the patient populations we often deal with are the elderly, which are people who are prone to vascular disease, diabetics, or people who have some predisposition to vascular disease, either due to genetics or smoking or other disease processes.
So, doctor, how exactly does vascular disease manifest itself? I mean, how does it affect the body?
It sort of depends on where in the body it's located, but vascular disease usually manifests by when there's a decrease. So for instance, if there's a decrease of blood flow to the heart, it can cause a heart attack. Vascular disease in the rest of the body is usually not so profound, but for example, a decrease in blood flow to the legs, for instance, if it's an acute decrease, can cause somebody to lose a leg if not promptly treated. So it can cause acute numbness or pain. If it's to an organ, it can cause organ dysfunction. If it's to the brain, it can cause a stroke. The other aspect, what we deal with, not only decrease of blood flow, but bleeding, so an aneurysm. If somebody has an aneurysm in the chest or the abdomen, that's something that we can address. The three sort of most common symptoms are a stroke, which of course is bad because it's a permanent loss of neurologic function. Usually it's manifested by one-sided weakness or numbness, can be difficulty speaking, difficulty understanding speech, could be visual changes. That would be bad. The next less serious symptom of that would be a transient stroke, a mini stroke, where you have these symptoms, maybe you're clumsy in an arm or you had trouble walking but it goes away, couldn't speak, you're stuttering for about 5 minutes and then it goes away. And then the third symptom would be a transient loss of vision.
So, doctor, we understand that Scripps does quarterly vascular screenings. What exactly are you looking for during these screenings?
We offer community screenings here at Scripps that look at three components of the vascular tree, and it's sort of a very quick, cheap ultrasound screen. And we usually do it on a weekend, every couple of times a year. And what the ultrasound tech will look at is the carotid to see if there's any occult carotid disease, look at the aorta just to make sure there's no aneurysm, and then just do a quick run through of the legs to make sure there's no peripheral vascular disease. And those three systems for us cover the most common disease processes. And also, if there is disease there, it usually correlates to some element of cardiac disease. So if patients do have a lot of disease, then we also can refer them to a cardiologist to make sure their coronaries aren't also affected.